thank you to all for attending today's kickoff of ASTARISQ, which is the Patients Program Summer Roundtable Series. ASTARISQ stands for Addressing Systemic and Structural Racism to Improve Safety, Quality, and Trustworthiness in Health Delivery Systems. And I couldn't be more thrilled to welcome our 4 panelists today to discuss structural determinants of health. As many of you likely know, structural racism and institutional policies and practices continue to shape who has access to health promoting resources and opportunities and who does not. Recent efforts to identify root causes in health inequity have highlighted how historical, systemic, structural, and political forces influence individual risk factors, such as clinical, behavioral, and even social determinants of health. In this year's kickoff, our roundtable members will discuss how they have navigated and addressed structural racism in their communities, as well as opportunities and promising practices for others to take steps to identify and address these factors in their own health delivery system settings and communities. Without further ado, I'll get into introductions. So I'm Hillary Edwards. I am the program director for ASTARISQ, and I'm going to ask our first panelist, Vu-Ann Foster, to introduce herself. Vu-Ann?
Hi, everyone. My name is Vu-Ann Foster, and I'm the founder of Life After 2 Losses. Our mission is to prevent reproductive and health injustices in the community. I founded this organization after suffering not 1, but 2 preventable pregnancy losses and almost nearly dying from severe postpartum preeclampsia. And again, I just was not listened to. And I noticed with the participants that we service that my situation is not unique. We offer grief support, and we also offer perinatal education for all, because we believe it's important for everyone to have access.
Thank you, Vu-Ann. Melissa?
Hi, thanks. I'm Melissa Moorhead, and I work for the Michigan Public Health Institute. For the last 9 or so years, I've been part of a national initiative called Data Across Sectors for Health. It is a national initiative that seeks to elevate models, principles, and practices, specifically to support multi-sector data sharing initiatives in pursuit of health equity. So I'm here, delighted to be here with the other panelists to talk more about the importance of structural determinants of health.
Thanks, Melissa. Ariana?
Hello, everyone. I'm Ariana Nuñez-Restituyo. I'm the lead consultant for my public health consulting firm, Pro Public Health Consulting, where we provide a lot of health education, social media management, focused a lot on maternal child health topics, along with the very multifaceted public health world. I'm also the health education and social media manager for the SID Center of New Jersey, and I serve as an adjunct instructor for the Rutgers Robert Wood Johnson Medical School.
Thanks, Ariana. Malini?
Good afternoon. I'm Malini De Silva. I'm a MedPeds trained physician and work at Health Partners Institute as a research investigator. One of my projects at the Institute is the Centers for Excellence in Newcomer Health, where we focus on the health of newcomer populations, so refugee, immigrant, and migrant populations. I also work as a physician in our county TB clinic and as a travel medicine provider.
Thanks, Malini. So for those of you who are attending today's discussion, we do have the chat as well as the Q&A available. We're going to have a roundtable discussion for approximately the next 30 to 35 minutes, and we encourage you to share your thoughts and experiences in the chat. And if you have questions for the panelists, we will go into the Q&A towards the end of today's session at about 1:40 p.m. Eastern. But to start us off, I would love to hear whoever would like to go first. Who can define what are structural determinants of health and how are they different from the more often discussed social determinants of health?
Well, I'd love to jump in just because I spent quite a few years of my career on this very topic. And one of the things that I have found very helpful was work done by Dr. Rishi Manchanda, who created an organization called Health Begins, who has a nice little table about the difference between social determinants of health and structural determinants of health, and also health-related social needs. So I think it's really helpful. It's been helpful for me because I think that what has been described, or what is being discussed most often when talking about social determinants of health, is often health related social needs. Social determinants of health gives us an actual larger framework to think about what causes those health-related social needs. And then just as a concept, structural determinants could be considered the causes of the causes. And also then is our opportunity to go beyond conceptual, to think about all of these things existing at once and what we can do at different levels to actually make an impact on health and wellness, both for individuals and for communities and for the system. So I really think that the value of beginning to shift some attention to structural determinants of health is in elevating that beyond just observing characteristics that can cause ill health, but then thinking about what put those causes into place.
Absolutely. Vuan, I know you have some thoughts on this too, and would love to hear what you hope to not only be able to provide for the conversation, but also what you hope to gain in participating in today's conversation.
Yes. So I hope today's participants can take away a new idea, a strategy, or a practice to address structural racism. What I love about conversations like today is that we bring together different people from different walks of life, different backgrounds and lived experience, where we can learn from each other to get ideas that maybe we wouldn't have thought of on our own. I hope the participants will share what they learned here today with someone, whether it's a colleague or a friend, as I'm a firm believer that we all have the power to be a part of change.
Absolutely. Thanks, Vuan. Ariana or Melanie?
Yeah, so I definitely hope to gain a lot of the same things as Vuan said. I'm excited to learn from everyone and all of the participants and just figure out certain issues and sectors that I personally haven't considered, and having those perspectives in mind as well. And so we can better understand all the intersectionality of all the topics that we're going to be discussing today. And to piggyback a little bit off of Melissa as well, when we're thinking about those structural determinants, right? We're thinking about policies, we're thinking about governmental structures, economic systems, education systems, right? Even our cultural and societal norms and things like that. So many different things for us to consider when it comes to structural determinants of health.
And I would just echo Ariana and Vuan as far as learning from each other, understanding new perspectives, and just hearing what the questions that come out, and getting some more a feel of what people are thinking about and where they're coming from.
Absolutely. Thank you all. And certainly to our attendees, feel free to use the chat and let us know what you hope to gain out of this conversation. Again, we can certainly add it to our dialogue. Melissa talked a little bit about the differences between structural and social determinants of health. And so I was wondering too, what might be some common misconceptions that people have about structural determinants?
So, yeah, so from my experience, just to give you just an idea, I'm a public health expert, and I'm currently making changes in regarding providing access to all regarding perinatal education. And I notice there's a misconception that the reason why BIPOC communities have poor birth outcomes is because of lack of access and due to lack of education. And again, from my experience, I have a master's degree. I have access. I had private insurance. Sometimes people ask me like, "Oh, did you have like different insurance? Is that why these are outcomes?" And from my experience, I learned that we're not being listened to. Again, when I was dealing with severe postpartum preeclampsia, I showed up to the hospital and to my medical providers 3 or 4 different times before they took me seriously. And by that time, I was literally dying. I had 30 pounds of fluid that was backing into my lungs. My blood pressures were hypertensive crisis. I was so bad that I had to be transferred with an ambulance administering drugs to save my life to a hospital that could better assess my needs. And they said I was about a minute away from being sent to the ICU. So again, just not being listened to, because when I left the hospital, I said, I'm experiencing this. And they kept brushing me off, and I kept showing up saying, I'm experiencing this. And I noticed with a lot of the participants that we service in the work that we do, they are reporting the same thing, not being listened to, being dismissed, or having their concerns minimized. And again, we're noticing that it's really to a lot of structural racism and just implicit bias.
Thank you, Vuan. Thank you, as always, for sharing your story. Others?
I think another common misconception with my experience working in the nonprofit field, specifically in maternal child health, just seeing how different programs are. Sometimes we see certain issues, we see certain health disparities, and then there's a program now that is going to address this health disparity. But many times what I've seen is that we get 1 year, maybe 3 years, if we're lucky, 5 years to have a program. I've worked in programs, for example, one of my first jobs as a community health worker for an improving pregnancy outcome program, right? So I went out, I did outreach, I provided education, I helped, connect families to various different social services and resources. But once that program only lasted like 3 years, and then it was gone. And then there was a new program, which was kind of similar, but it totally took out the health education component, which is one of the things that I found was most helpful in building our communities and building everyone's own empowerment and being able to feel like, okay, I have a better understanding of these topics. It's not just about I need access to food or diapers. It's what kind of foods do I need to eat? How can I also access these foods? Right? Because sometimes when we go to even food pantries, right, there's not everything that's not culturally sufficient for everyone. There may not be foods that people can cook in their own homes if they're like, for example, something that I saw too, even having canned goods. Some people don't have a can opener or even a microwave or anything to heat up their food. So when we're giving people food and we're doing certain things, we're missing a bigger picture when we're not having these conversations and we're not educating our community, and our community is not able to educate the providers as well. So we're missing those links to have a better understanding of how can we truly help our community. So I kind of went all over the place, but just being also sure that as we're continuing our programs that we're not limiting ourselves and we're not taking out integral components like health education, because we're truly limiting our community and ourselves.
Other thoughts, Melissa or Melanie?
While we're waiting, I can piggyback off of that.
Sure. Yeah.
So as Ariana said, I think it's very important to, when we're creating these programs, to really assess the needs of the community, because sometimes I think we have an idea of how these programs should go, but we're not really involving the community members who are using the programs. So for example, with Life After Two Losses, one of the things I figured out was that there were grief support out there, but it wasn't benefiting the people necessarily. It was leaving us stuck in depression, anxiety, and we were reliving our loss experience time after time, and we would leave and we wouldn't know what to do with these thoughts. So this is why I founded Life After Two Losses, because I said I need to get my life back to a healthy place. And I'm not the only one. I see other people are wanting to do that, but they don't know how. So when I founded Life After Two Losses, we spent a small amount of time talking about our losses, and the majority of the time was how we get our life back to a healthy place. So giving them tools and tips on how to do that. And basically, I built that program based off the needs of the community. So I think sometimes when we're making these programs, we really need to have the focus in mind of what the community needs. And that's like a needs assessment. That's asking, questions of, those that we're supporting. How can we best serve you? Because if we're not doing that, we're missing the mark.
Absolutely. Melissa, I see some emphatic head shakes over on your screen.
So this was a tough one that I've been thinking about, but I don't know if it's a misconception, but a very hard to dispel notion for me is that these structural factors can be too big to change, or that we would have had to have started a long time ago. And I just think that in addition to mounting evidence, we have evidence right here at this table that individuals are suffering personal harms from structural racism, and that they can make a difference in their personal actions to address these causes. Get at both the root cause analysis, thinking about the needs assessment, but then also like the right place to center leadership for change.
Absolutely. One of the things that both of you mentioned, and Vuan, I thought about this from actually a paper I read earlier this week on trust and trustworthiness. And often we evaluate how trustworthy a health system is without thinking of how do clinicians and providers, how trusting are they of the patients and what they're sharing, right? Sharing what's happening in your life and believing you in order to build trust that's reciprocal, right? So they know what you're experiencing, not just that they're the expert and competent sort of person able to navigate the system. So I want to hear a little bit about how can the system be better about trusting their patients and the people that they serve to tell them what they need in order to provide better care. Thoughts on that?
So I think it needs to be a partnership. I think when you're going in with any provider, there needs to be this understanding that while you are the expert and I'm coming to you for a service, that I have stake in this as well. So for me, I've learned that when I just showed up and I expected them to do everything, the outcomes were poor. But when I said, listen, we're going to work at this together. So this is what I've come up with my research, and this is what you're telling me, and this is how we're going to collectively work together. I found the relationship was better and stronger. Again, in my experience, my medical provider did not have experience with someone with my condition. So he ended up sitting in on my surgery that allowed me to have a healthy son, so that any other women that comes in his practice will not have multiple losses now, that he can now provide that service to them. So I think that tends to the trust building. Again, I showed up and said to him, I had 2 losses, but I'm not leaving here. We're going to figure this out together. So I think while that's admirable, right? Because many would move on, as he said, I think it's the only way that we can build change in the system is when we learn to work together and trust each other.
Absolutely. Malini, what are some experiences that you've had in your practices and working again with the diverse populations that you serve for building partnership?
Well, one of the biggest things I think is the availability of interpreters for the work I do. I work with a lot of non-English language speakers, individuals with limited English proficiency, and it had been standard practice in some of the health systems that I worked in to provide in-person professional interpreters, and that it was just the standard of care that everyone would have those. I think oftentimes, as I've worked in other systems, there's the onus on the patient to request that themselves rather than making it just readily available. And we know there's multiple resources and to provide interpreters, even if it's not in person, but that their patients' clinical outcomes, their satisfaction with the care they receive, the quality of care is improved when an interpreter is used for these populations, and yet it's not become standard for everyone. And so I think I was very fortunate to have that training in systems where they were readily available, but have also been in systems where that's not the norm or standard of care, and that we have to do more at the patient level before a visit to ensure that their language needs are being met.
Would I be able to piggyback off that?
Absolutely.
So I worked in a number 1 trauma center as a patient representative in one of New Jersey's major hospitals. And one of the things that they were trying to implement was, again, taking the ownership off the patient, saying, oh, well, the patient didn't ask for a provider. That if you notice that in their chart, they spoke multiple language and English wasn't their first language, that you would call an interpreter in-house, or you would use, they had a machine where you can connect with any interpreter of many languages. And I felt that at first staff was resistant to use it because they felt like, oh, it takes too much time. I just need to get this information. But you don't really get the full picture if they can't understand what you're saying, or they're just saying yes, because they just kind of want to give you what you want. So kudos to you, Milena, for doing that for your patients, because I've seen that when they do use the interpreters, it is much beneficial for both parties. They get all the information they need, and the patient also feels heard about the decisions they want to make.
I would also add that during the start of COVID and with the switch to many virtual visits, we found a number of issues with getting that interpreter into those virtual visits. And there's been a lot of work that's been done. But still, I think there's a lot that needs to be done to ensure that the systems that health like the electronic IT infrastructure, all of that, has the ability to integrate the interpreters into video visits, to virtual visits, to other things, to help with that communication, because there was a big gap in care for those limited English proficiency populations during that switch to a lot of virtual care.
Ariana or Melissa?
This is with the question of how do we get communication better on both the healthcare provider and communities end. I worked on a program where we often partnered even with medical schools and medical students to start giving them more exposure to what, because we obviously work with families in a much different way than a doctor would. We get to sometimes visit their homes. We get to spend more time with them. We have case management with them. So having that opportunity to talk to future doctors and nurses and share our own experiences with them, I found was so beneficial for both of us, because we both had the understanding of how can we also, as social service providers, right, talk more about healthcare providers and their needs and what certain visits are going to look like, certain procedures that they may be going through, and start preparing them as well, and getting them more educated, helping them prepare questions that they may want to ask their healthcare provider, certain things that many times anyone in medical school or even practicing physicians now, they don't get the opportunity to talk to people who are out there in the community, working with everyone, working with people in a much different capacity than they're able to within, sometimes they're only like 5-10 minute visits, right? So I definitely, I feel it's so incredibly important for different organizations, different career paths to work with one another and share our experiences so we can just help each other overall.
Absolutely. Melissa, go ahead.
Well, I was just, this has put me on a path of with especially thinking about interpreters for the necessary conversations, and how that led Ariana to be talking about different perspectives and working across disciplines in the field that I've been looking at for the last little while, about data systems. I'm thinking about the role of the importance of these different perspectives and collaborations, examining data from different perspectives as well. So have that sort of interpretation level applied to both the interactions and then the science and understanding of what's happening and how to address it. It's an interesting through line there.
Absolutely. That actually, yeah, go ahead, Gwen. Mm-hmm.
So after hearing what Ariana and Melissa said, it just made me think of something. And I know one of the things that the doctors would say to me was, how did you get that information from the patient? And I'm like, I think sometimes when you're going in there, my time is a bit different than a provider's time, because I think in our line of work, or in the work that I was doing, they were okay if you spent X amount of time with the patient and you didn't get to, as long as you were able to take care of that situation. So I feel like sometimes when you go in there, you're not on a time crunch and you can just actually talk to the patient, you could tend to get more information. They feel comfortable to share more with you. And there's not this pressure that I have to give you an answer that you want to hear. So I think it is very important that we, as your medical care team or the hospital team, for us to collaborate and work together with each other, because then we all come together with a different perspective and would be able to provide information that could really help the patient as a whole.
Absolutely. Many of our panelists have shared how they've navigated personally and professionally these structural determinants of health. And Melissa just brought up a great point about data, and Luann talked about being able to collect data. And so I'm interested to hear about what role does data play in structural determinants, either as a maintainer of some of that structural oppression that we've talked about, or as a transformer to create more health equity.
I'll share as a maintainer, certain things like when people are selectively reporting certain information, right? Picking the information that is going to fit their cause, fit their issue, whatever it may be, without providing the full story. For example, I worked on a program focused on peer health education, and we were really focused a lot on decreasing the disparities between, infant and maternal mortality that we've seen with Black women, right, and Black babies. And many times when it comes to the curriculum, that is what we were talking about. Just the stats, all the negativity, we didn't provide any historical context. There was no additional information of how do you get better? How do we address these concerns truly? And when I was seeing that, I was just kind of like, why aren't we talking about what we're discussing now, the structural determinants, right? And after bringing that up, we started changing the curriculum, thankfully, and providing much more information, more historical context, more policies and certain things that have been in place so we can all have a better understanding of why are we seeing these disparities. And not only are we seeing these disparities now, but we've been seeing them in, well, I focus in New Jersey, right? But for like 100 years since data has been collected. So why aren't, even though we have this information, why aren't we moving forward and using this data in a much more positive way? Of course, there's a lot of wonderful programs that are out there, including Vuan's program, right, that are doing amazing work and helping families. But when we're just selectively choosing statistics to just kind of focus on one highlight, just to highlight one thing rather than looking at the bigger picture, we're really doing a disservice to the program itself and to our communities that we're working with. So really making sure we're not being so selective with the reporting and being as transparent as possible with the information that we have in that data.
To just expand on that as well, I think the data that is collected needs to be more granular. So collecting primary language, collecting more information about gender identity, not limiting it to just like birth sex, having this data that we want to report on and to be able to evaluate health outcomes with, we need to actually collect that data and do it systematically so that it can be, combined with other health systems, other public health agencies, whoever is doing the data analyses. But if we're going to report on outcomes for different population groups, we need to have that data collected. And I think we do find that there are differences when you don't just look at broad categories, like broad racial categories, but rather if you're looking at language categories within those broad racial categories, or birth outside the United States in addition to the racial categories, or even more granular ethnicity and racial categories, that you can identify these disparities. And it's only through reporting of things at a more granular level that we'll be able to make the systems or policy changes that are these structural determinants of health that will be able to change those social determinants of health. So really thinking about how we're reporting on data, what data we need to collect in order to make the changes that we want to see.
I love this juxtaposition too, because Ariana made me think of that famous saying of there's lies, damn lies, and then there's statistics. And the meeting in the middle there, we need to collect better and more granular data and have a lot of information available, but then also look at it with different perspectives and trying to get at the truth behind those statistics that might not be observable from one perspective alone. Again, getting back to those translation services, what do these data mean to different people, or the different people that they represent, right? Because data also represent real human experience that is somewhat subjective in my experience over time.
And along with that too, I feel like a lot of the data that we tend to see, right, it's all quantitative. But right, as everyone's been saying as well, we need that qualitative data. We need the stories. We need to have a better understanding. What do these numbers even mean? And based on these numbers, right, and we're focusing on these people's stories as well, their experiences in healthcare and all of these different things, right, then we can truly make more change, because numbers alone don't give us they will never give us the full picture. They're incredibly helpful, and especially depending on who we're talking to and certain funders and policymakers and things, and it's necessary. It's always necessary. But without that qualitative aspect, without that personal anecdotes, without the human side of things, we won't be able to make the changes that we need to structurally.
I agree. I think I learned early on in my career when I first started working with Ariana that she would have me come out and share my story. And I noticed that it would be really impactful. Like, again, we would give the statistics, but when people heard my story, I felt like it moved them to change. And I notice in my work now where I use the data that we collect in twofold ways. I use it, one, to go after funding, because I need to be able to justify why we need the funding to be able to do this work. But then I also use it to change the minds and hearts of politicians who can then change policies so that we can make, things better overall. So for my organization, data works in two folds.
Absolutely. One of the things that came up in our planning session was, how can we help individuals understand data, understand their own data, the importance of sharing and collecting data, equitable data collection and representation? Thoughts on recommendations for how we can bridge that gap?
Yeah, so I know something we do with our participants is we give them a brief disclosure of why we're collecting their data. And usually, again, sometimes people are defensive, like, oh, you're asking a lot of questions, you're asking income, but we let them know that we're able to provide this programming free to them, because then we can go back to our funders and tell them this is who we're serving. And when you give it to them like that, they're more inclined to be able to, again, provide you the data. Because again, our grief support is free. We do not charge those who use our grief support, because we believe they all should have access to mental health care. And again, we just need to be able to provide that to our funders or who we're servicing in order to keep it free. So I think when people understand that, they're more inclined to be able to fill out the surveys.
Oh, Vuan, you just brought me all the way back to 2005 and working in HIV case management, where I literally said those same words. Like, we're trying to keep these services free of charge, but they're not actually free, right? We have to ask you for detail and data. And at the time, and even more since, as I've gotten to act in a more philanthropic role, I really think too that philanthropy could play a bigger role in helping to close this trust gap regarding personal data by making sure that people are remain centered, right? It's not just extracting individual data in order to get the information about outcomes or funding for the services, but how about circling back to tell someone that your story mattered, and this is this is also part of your compensation, is that you can see how your insights are making an impact in keeping the services available, but also in helping to create better insights into the situation that we're in. So thanks for that.
Yeah, one of our attendees put this in the chat to the panelists. There's a lot of mistrust in the data collection. As someone who collected this data, I frequently heard that people were reluctant to disclose because they had not felt it resulted in real change. So, right, in responsible data management, what are some things that health systems can do to, again, return those results or demonstrate the impact, Melissa, sort of as you mentioned, of that data collection for bettering the services that can be provided?
I think a lot of organizations now are listing, we've serviced X amount of people. Out of those people, these people were low income. And I think it's very important. And I think a lot of organizations are doing a much better job of highlighting the data on their website, so it's at your forefront, so that you can see like, oh wow, like, I filled out this survey, because I know anytime, it's a lot when you receive a lot of surveys. I do a lot of this work and I get surveys as well from attending a webinar or doing a program, but when you can see like, wow, the change is like forefront in your face. So I think if more organizations, again, can keep up that, or doing things that I noticed most recently is attending programs in person, they will have a recipient of the program come out and speak and share how impactful the program has been. And when you look around, people are like people are really moved by that. So I think highlighting the personal stories, whether it's like an in-person interview, a video, or just a quote, but by doing that, I think people will feel more inclined to share.
And just going off of that as well, I completely agree with Luann how important it is. And it's wonderful to see more organizations showing their data, showing all the things that they've been collecting to have a better understanding of what are the demographics of our community in different capacities, right? So just continuing that is very important. And whenever possible too, whenever you have attention, right, you'll tend to have contact information and being able to let them know, hey, at the end of this program, this exactly as Luann was saying, but being able to share even a report with them as well and more information could be so much more helpful. And letting them know too, as they're seeing these numbers, as they're seeing all this information, how this is going to now help benefit hopefully future programs, increasing funding, changing policies and things like that, and helping empower the communities as well to speak up and to be able to share certain information. Because when we're looking at certain health aspects and health outcomes that we want to improve, it's just going to be so much more helpful to continue this wonderful work when we're all also able to say, hey, I participated in this survey, I participated in this program. I have already seen how this has benefited so many people. Let's keep on this conversation. Let's keep talking to more people and sharing this information with as many people as possible until we can get to that point where, because I wish it wasn't all about money, but that funding drives all of this work. Because we all need to live and we all need to eat. We all need to have healthcare and pay for everything, right? So we just have to have that in mind as well, and just help empower everyone to use that information.
I also think, sorry, Melissa made a great point, and she said these services aren't free, right? Because they do come with a cost, but we're able to provide it free because of this. So I think even highlighting that, like, these services come with a cost, but we can provide them free to you because we're able to get funding based off this data. So even changing the verbiage to that, I think is a great point, Melissa.
Thank you all for that. And as we begin to transition to our Q&A period, I want to encourage the attendees and participants to continue to use the chat, and you can submit your questions to the panel via the Q&A box. But one last question before we move there, which is that systems change can feel overwhelming. So you all have sort of mentioned some aha moments that you've had as individuals, but what can be done on an individual level to help address these changes?
Storytelling. Storytelling saves lives. I say it all the time. So even if it's not your own, if you hear something that somebody else share with you, share it with someone else, because knowledge is power. So I think if we keep, again, if you learned something from this webinar today that you didn't know before, share it with a friend, share it with a colleague, keep sharing that, because as long as we continue to do that, that's how change will happen.
I think a big thing too is make sure to vote. Stay aware of what's going on nationally, locally, and using your voice whenever there's town meetings. If you're able to go participate, make the phone calls, send the emails, because a lot of the times the people who are able to make this change are in the political realm or in different companies and things like that. So we need to be able to share our voice, and whenever possible, just definitely vote for the things that you believe in, and making sure that are locally, especially, that we're making the changes that we need to, and not allowing things to stay status quo.
Melissa or Malini, words of wisdom for the individual trying to make change?
I think Ariana hit on the head with voting, and just making sure your voice is heard, responding not only when you're asked, but also if you see something that you want to change, saying something.
I just couldn't have put it any better than the other panelists. And additionally, I mean, it's telling stories, listening to those stories, and supporting the people who are brave enough to get them out there. Not everyone has the ability to be on the front lines like Luann, right? So the more support we can offer to Luann and others, all of us in this space that are trying to ensure that the work that we do as individuals can perhaps make a structural impact. There's something about passing it on and doing it together that I think is really important. So telling our own stories, but also supporting those who have a really important story to tell.
So real quick, make sure to also participate in local programs, right? Because a huge thing that all these programs want to see is how many people are participating, how many people are attending events, how many people are utilizing grief services like Luann is providing, how many people are utilizing these things. Because as they start seeing, right, the funders, right, the people at the state, whoever it may be, right, when they see that more people are participating, more people are truly using these services, that is what's going to keep these services going and helping them expand, right? And we have to be able to share the resources that we know, share whatever's going on at the library, share what's going on with local nonprofits, faith-based organizations, whatever it may be, share that information with others as well so more people can participate, because that is going to help continue programs, right? Continue that funding and truly help expand it so we can get to this point where we're making structural change.
All right. So we do have a couple of questions in the Q&A. And so the first one is, from a patient perspective, what are our data protection rights? Melissa?
Just because I've always been so focused on data, one of the things that is just very uncomfortable for me, so this is nervous laughter, is the idea of privacy and data protection, right? Because I personally signed away a great deal of my data for 10% discount at Food Lion grocery stores in 1992, right? So I think maybe part of the answer to this is becoming better informed about the ways that where your data lives and where it goes and what it's being used for, with that sense of skepticism that you can't, like, there are many different ways that your data is being collected and used. And if I don't know that we're going to be able to get to some magical place where our data is always only collected and used the way that we want it to be, because we also don't have perfect foresight into situations where it might be useful for someone to know this and not the other. So I am a little bit concerned about taking that approach as opposed to just being aware and maybe a little bit proactive as an individual to think about, well, this is like who I am and how to manage the different impacts that my data might have in the world, just by keeping an eye out for it and maybe shepherding it a little bit, because I don't read privacy notices. Even if I do, I can't understand them very well, right? And I also will still get the services that I need, because I'm not gonna, that shouldn't be a barrier. Much better to be thinking about, I think, making the structural changes that ensure that our data isn't used against us or for a purpose other than what we want, than to just try to put it back in the box and figure out how to keep it locked up. But that's very personal.
Other thoughts on data protections, having access to your data, the electronic medical record?
That's just not my area of expertise. While I've worked in the hospital, I've not done much work surrounding that, so I wouldn't want to misanswer.
And within our healthcare institution, we do have patients sign a form that says they're opting out of research, but I agree with Melissa, like, you sign these papers, a lot of people don't take the time to read them. You don't know what you're signing, and it's hard. So there are those opt-outs available, but I think, again, it's an onus on people to do it, and whether that's the right way to do it or not, I'm not sure.
Mm-hmm. One of the things, and my little plug for the remaining sessions as part of our ASTARISQ series, is we've been talking about how people interact with their own electronic medical record and how they're having conversations with clinicians or providers to document the conversation as they see it, where we're going to have some panelists later in this series who talk about having the systems or their doctors correct the after visit summary because it wasn't in their in their conversation or in the voice or the things that they specifically said in that conversation. So while that's not specific for the data protections that we're talking about, data is something that is going to continue to come up over and over and over as we have the conversations over the course of this summer series. Again, really appreciate in the chat where there was more, wishing there was more transparency and sharing of data across institutions, not gatekeeping by payer sources. And liability and accountability, again, around data and around the conversation is something that is a mountain to climb, but hopefully we'll be able to address that not only through our conversation that we've had today, but through the ongoing conversations as part of ASTARISQ and the other initiatives that both the patients program and all of our esteemed panelists have in the work in the communities that they serve. I have one more question and then we'll go into wrap up. So, what has kept each of you going? You've been doing this for many years. How do you keep that passion? How do you keep that drive? How do you keep that optimism in making change when some days it just feels like an endless uphill battle?
I can start. So again, I've experienced some really traumatic events in the birthing space. And I think what keeps me going is I never want someone to not only experience a loss, but multiple losses. I also don't want someone to experience being treated differently simply because the color of their skin. And that's what keeps me going, knowing that my daughter's short lives wouldn't be in vain because of the work that I'm doing for them, in honor of them, to be able to bring about change.
I do see there's small incremental changes that I've seen happen over the course of my work. And so I think you have to take the small wins and know that, or stay optimistic that things can change. And I think working with groups of dedicated people who are also passionate is what has kept me motivated, that there's always infusions of new people, new residents, other people. So I think getting those infusions every so often is important to see people that do come in with a renewed sense of optimism about this.
Yeah, I agree with Malini as well. Just having gotten to meet and work with so many wonderful people, learning from all of you and seeing that people truly do care. People are doing amazing work. They're being innovative. They're also sharing their knowledge with others and not gatekeeping information, right? And just trying to help us all become uplifted. It truly keeps me going in this work. And I was also thinking, many times, right, we all have things that we go through. We all have our certain cycles, generational cycles that maybe we're working towards overcoming within ourselves. And then looking at our country as a whole, right? The cycles that we've kind of been seeing, certain history repeating itself. But at this point, we have so much information out there. So much information is available. There have been so many wonderful programs that have done amazing work, and so many things that we are continuing to learn from and we can keep improving on. And that kind of keeps me going too, knowing that there's just such an influx of information that we can continue to utilize and keep building and work towards breaking these cycles and work towards truly achieving an equitable society, which I know it's possible, but we just need to have more voices and more people feeling empowered, more people feeling educated, knowing that you don't need to have advanced degrees to become an educated person, right? You just need to be in the space as well. You need to have these conversations because we all have vast knowledge that is so incredibly important. So just remembering that, and just there's a lot of wonderful people out there. So I know that we can do it. We just got to work together.
Oh, just here yet again. I keep being reminded that somebody said cynicism and pessimism are tools of oppression, and I think that's the key, right? That if we can't individually find these connections and trust in each other and the future, that they come together as individuals and create systems change and actually learn from these experiences. Like, so our own life work won't have been in vain. Like, so it's good to celebrate these connections and a series like this, which brings together so many different perspectives to, I think, kind of keep that flame alive, that we really can be part of a systems change, learning our way forward.
Absolutely. So thank you all again for participating in today's discussion, and certainly to our attendees as well for listening. And one thing that I learned very early on from one of my community partners here at the University of Maryland, Baltimore, is to avoid the train and pray model. It's to avoid, like, we have this amazing discussion, people are feeling motivated, and then we go off and just go back to the status quo. So to finalize, or to wrap up today's discussion, though certainly the conversation is going to continue not just in the Summer Roundtable Series, but beyond, what's one call to action that each of you has for our attendees to take from today and move it to practice within their daily life?
Again, share. If there's something new that you learned here, a new idea, a new practice, a new strategy to address structural racism, share it.
You know, I was going to say something similar at some point, like owning your experience, like being confident that you do have something to share, even if it is something that you're passing along. But I'm also realizing that maybe a call to action is, you know, let's LinkedIn, let's meet up, let's get out there and find those community organizations and opportunities to intervene with policy, politics, community-based initiatives that will help feed our souls in the journey, as well as creating that change. Look me up.
I was going to say something similar to Melissa, just as far as thinking, think if there is one thing or maybe two things you're really passionate about that you want to see changes in, look to see if there is a local organization or like whatever level it is that try and join that organization and look at what they're doing, see if there's something that you can join as part of that passion.
That's what I was going to say as well. If there is an organization, a program, something that you see that you are truly interested in, participate. If you're able to donate, even $5 is going to be beneficial. You know, participate in any capacity that you can, but be there. You know, and share your voice. Share that as everyone's saying, right? That's the most important thing. Share what you've learned. Share it with others. Share your passion. Share your enthusiasm with others, because that's infectious, and that's really what we need to keep this moving.
Absolutely. Thank you again to Vuan, Melissa, Ariana, and Melanie for participating in today's conversation and kicking off this incredible series for addressing structural determinants of health. Again, please share your resources, check out the website for our ongoing conversations. And again, the discussion doesn't stop here, even within this group. So looking forward to connecting with each of you and hopefully seeing many of you next week at the same time for our next discussion on addressing structural determinants of health. Take care, everyone, and have a great afternoon.